Tympanoplasty, a surgical procedure designed to reconstruct the tympanic membrane and restore middle ear function, is categorized into types by Wullstein, a foundational framework widely recognized in otologic surgery. Let's break down the 5 types of tympanoplasty according to Wullstein's classification, as detailed in Sataloff's Otolaryngology and head and neck surgery. Type 1. Myringoplasty, where the tympanic membrane is repaired without involving the ossicles. This is typically used when the ossicular chain is intact and mobile. Type 2. Here, the tympanic membrane is repaired, but the malleus is eroded. The graft is placed onto the incus or the stapes head, bridging the gap. Type 3. In this type, the tympanic membrane is attached directly to the head of the stapes. This is often necessary when the malleus and incus are absent or non-functional. Type 4. This involves grafting the tympanic membrane to the stapes footplate, used when the stapes superstructure is absent, leaving only the mobile footplate. Type 5. In cases of a fixed stapes footplate, a fenestration is made in the horizontal semicircular canal, and the graft is placed over this opening. This is a more advanced and less commonly performed procedure. Understanding the indications and nuances of each type is critical. For instance, type 1 is straightforward and commonly performed, while type 5 is more complex and used in select cases. Let's discuss a case. A patient with chronic otitis media presents with a perforated tympanic membrane and partial erosion of the malleus. Audiometry reveals conductive hearing loss. Based on Wullstein's classification, what type of tympanoplasty would be ideal? Applying the correct type not only restores hearing, but also prevents recurrent infections. Recognizing when to use each type is a skill honed through both study and surgical experience. Remember, the choice of tympanoplasty type depends on the extent of damage to the tympanic membrane and ossicles, as well as the functional status of the middle ear.